September marks World Alzheimer's Month. This morning we have Dr. Tiffany Reed with Cone Health. She practices at Piedmont Senior Care and Adult Medicine. Good morning, doctor.
Good morning, Brad. How are you?
I'm doing just fine. I hope you are too. First off, let's talk about some of the basics. How would you diagnose somebody with Alzheimer's disease?
So Alzheimer's disease is a clinical diagnosis. We look at history, a physical exam, imaging studies, sometimes some genetic markers as well. And it's really not a certain diagnosis. It's often mixed with other types of cognitive impairment and dementias like vascular disease.
You know, this is, go ahead, continue, I'm sorry.
So it's really gradual in onset and typically involves memory loss early on. Later on, we get changes in speech, visual spatial skills, physical challenges, and sometimes even behaviors at some point, quite often, in fact.
You talked about this being something that is very gradual, and I imagine once families at least hear this, they have a process to go through. What are treatment options? When you talk to either a patient or a family, what are some options that you normally present to them?
So we have a couple of medication classes, but these aren't really the most important treatments to, keep families from being stressed and to really help out our patients. The two classes of medications may kind of modestly delay behaviors and minimally affect the cognitive measures that we look at, but it's really these changes we make in environment and cognitive stimulation that can help these folks, providing things like supportive therapy to reminisce about things from the past, family and caregiver support from groups like Wellspring Solutions, the Memory Center there, locally can really be helpful for these folks.
Yeah,
environmental modifications like the Safe Return program to be sure that if folks wander off, they can make it home, fall prevention, medication management, and having a really structured routine at home.
Well, after someone is diagnosed, we were just talking about the treatments there. We hear about clinical trials. Is that an option for somebody dealing with Alzheimer's?
Certainly, and most primary care physicians are aware of places to access this information. A lot of times the websites that can help can be the Alzheimer's Association Trial Match, National Institute on Aging, Alzheimer's Clinical Trials Consortium, and some of the pharmaceutical companies and academic centers will also have access to what trials are open at the present time.
So are there things on the horizon, things that you've heard about or read about that might be possible for treatment in the future?
Well, recently they've actually looked at a blood test to detect Alzheimer's disease early on, which is showing some positive signs, which would be exciting for those who want to know what's happening in the future and how to plan for it. They've also been looking more at treating the tau tangles that can form in the brain and rather than amyloid plaques. And finally, I found particularly interesting that a couple of studies in different locations recently looked at vaccinations and how flu shots and pneumonia vaccines and having taken these consistently when recommended help you be less likely to develop Alzheimer's disease in the future. So I encourage folks to go out to their Cone Health provider and get their vaccinations up to date.
You know, I think all of us feel when you get older, you're going to start losing a few, your memory or things like that. When is it part of getting older, and when is it truly a case of Alzheimer's? I think a lot of people don't know where to draw the line there.
And so many times folks are concerned if they've left their keys in the other room that's really a sign of Alzheimer's disease. But we get more concerned when we see problems with keeping appointments, managing medications or finances those tend to be earlier signs that we need to look into this a bit more, do some testing, and check with primary care for an initial evaluation.
Okay, Dr. Reed, we appreciate your time and your expertise this morning. Thank you so much.
And thank you, Brad, for having me.
I'm glad to talk to you. Of course, you can get more information on clinical trials that we were talking about by calling the National Institute on Aging. You see their phone number on the screen, or you can visit them online as well.